HIV testing. You can look and feel healthy for years when you first have HIV in your body. There's only one way to find out whether you are living with HIV by having an HIV test. Should you have an HIV test? Finding out as early as possible after being infected with HIV is important. This way, you can get help and avoid spreading HIV without knowing it. HIV testing is an essential gateway to HIV prevention, treatment, care, and support services. Approximately 81% of people with HIV globally knew their HIV status in 2019. The remaining 19%, which is about 7.1 million people, still need access to HIV testing services. How do I have an HIV test? You should go to a clinic if you are thinking about having an HIV test. The health worker should sit down and talk to you about the test. You can decide whether or not to have the test. No one can force you to have an HIV test. It is your choice. If you decide to test, the health worker will take a blood or saliva, which is a spit sample. This will be checked for HIV antibodies, which are made by the immune system soon after you are affected. New technologies to help people test themselves are being introduced, with many countries implementing self testing as an additional option to encourage HIV diagnosis. What if my HIV test is positive? You are infected with HIV. You can spread it to your sexual partners if you have unsafe sex. You must always use a condom if you have sex. It is important to tell sexual partners that you are HIV positive. Discuss this with a counselor or a health worker. You must not donate blood. Pregnant women who are HIV positive may infect their babies. Not all babies will be infected with HIV. HIV can also be passed on during breastfeeding. The test cannot tell you when you got the infection or when you will get sick. What is if the HIV test is negative? No HIV has been detected in your blood. You may not have HIV if the test is negative. However, it may be necessary to test again. You could be in the window period, which is the time between you are infected with HIV and the tests used by doctors and clinics become positive. This is usually 2 to 4 weeks. If you are HIV negative, keep yourself safe from HIV in the future. The key is to stay negative. Let's look at the interaction between TB, tuberculosis, and HIV. HIV has led to a resurgence of tuberculosis, particularly in Africa. TB is the most common illness among people living with HIV. Fatal if undetected or untreated, TB is the leading cause of death among people with HIV, responsible for nearly 1 in 3 HIV associated deaths. Early detection of TB and prompt linkage to TB treatment and antiretroviral therapy, or ART, can prevent these deaths. TB screening should be offered routinely at HIV care services, and routine HIV testing should be offered to all patients with presumptive or diagnosed TB. People living with HIV with no TB symptoms need TB preventative therapy, which lessens the risk of developing TB and reduces TB HIV death rates by around 40%. It is estimated that 44% of people living with HIV and TB are unaware of their co infection and are therefore not receiving care. Let us look at sexually transmitted diseases and infections. Sexually transmitted diseases are infectious diseases that are spread from one person to another by sexual or other intimate contacts. There are numerous sexually transmitted diseases like gonorrhea, the drop, syphilis, herpes, etc. Most STIs have an incubation period from 9 days up to 3 months, and the infected person might not be aware that they have an infection until the disease becomes symptomatic. No STI or STD should ever go untreated, or the quality of life of the infected will be severely diminished, and this will eventually lead to a painful death. Studies have shown that the presence of sexually transmitted diseases or infections increase the risk of HIV transmission because they cause ulcers and lesions that open the skin. The full course of treatment must be taken as prescribed by the health professional, and the patient must abstain from sexual relationships until proved healed. Once a person has been treated for an STD, it does not mean that he or she is immune to that disease. If unprotected sexual relationships are had with an infected person in the future, the same or a different STID may be contracted. We are now looking at medicines that are available to lower your chances of getting HIV. The first pre-exposure prophylaxis or PrEP, an HIV negative person can reduce their risk of getting HIV by taking oral PrEP regularly. The drug works to help prevent HIV from replicating within the body's immune cell, which helps to prevent a permanent infection. For PrEP to help stop HIV replication from happening, drug levels in the body must remain high. If pills are not taken consistently as prescribed, there may not be enough medication in the body to reduce the risk of HIV infection. Post-exposure prophylaxis or PEP. PEP can be used after exposure to HIV in a work context, which is occupational PEP, or after exposure to HIV that is not work-related, such as sexual exposure or injection drug use, non-occupational PEP or NPEP. Your doctor can prescribe the same medicines used for PrEP to reduce your chances of getting HIV. PEP consists of a combination of 3 HIV medications that an HIV negative person takes for 4 weeks to reduce their risk of getting HIV after a potential exposure to HIV. PEP should be started as soon as possible, but definitely within 72 hours of being exposed to HIV. The prescription drugs used for PEP need to be taken every day for 4 full weeks or 28 days. If the pills are not taken consistently as prescribed, there may not be enough medication in the body to prevent HIV infection. Antiretroviral therapy or ART. It's recommended that people diagnosed with HIV start antiretroviral treatment straight away. This is because the sooner you start treatment, the sooner you can benefit from it. Starting treatment as soon as possible protects your immune system from damage and gives you the best chance of staying strong and healthy in the future. People with HIV who take ART as prescribed and keep an undetectable viral load can stay healthy and help prevent HIV transmission. Combination ART, first produced in 1996, has led to dramatic reductions in morbidity and mortality. Access has increased in recent years, rising to 25.4 million people, which is 67% of people living with HIV in 2019. This means that 12.6 million people are still waiting. UNAIDS reports that in 2019, of all people with HIV worldwide, approximately 59% of all people living with HIV are virally suppressed, which means they are likely healthier and less likely to transmit the virus. Once you are on antiretroviral medicine, your doctor will do blood tests to make sure that the medicines are boosting the CD4 count and decreasing the viral load. It is very important to go back to your doctor for those tests. For antiretrovirals to work properly, they must be taken correctly. You must remember to take every dose of your medicines every day. If you miss medicines, HIV will become resistant to that medicine and your retreatment will have to be changed. For your reflection, here are some questions to stimulate your thinking and action planning. Number one, can you explain how untreated STDs greatly increase the risk of HIV transmission? How would you describe the interaction between HIV and TB? Can you explain HIV's effect on the human immune system? Why would you encourage a person to go for voluntary counseling and testing? Can you name medicine that a HIV positive person can use to boost his or her immune system and prevent infection?